the detailing of the stomach. This is the abdominal part of esophagus, which is containing. So this is a notch, the cardiac notch at the level of T11, and then this is going upwards and backwards. And to the left, take a turn. This is the fundus, which is filled up with the funding gash. Then this is the greater curvature of the stomach. Comes over here. This is a pyloric antrum at the level of lower part of L1. There is a pyloric sphincter. Then this is a pyloric canal. This is a pylorus and first part of the duodenum. Okay, continuous. Now here is a lesser curvature of the stomach. There is angulation. This is called angularis incisorius. That is the notch over here. Here is a vein that will identify the P-pyloric vein of Maurer. That is the identification of the pyloric part of the stomach. Okay. So cardiac end, pyloric end, fundus, body, pyloric canal. This is the abdominal part of the esophagus. This is the first part of the duodenum, continues to be as the second part of duodenum. So these are the parts of the stomach, which will be asked during a practical examination. Now, what are the ligaments attached to it? To the lesser curvature, this is a ligament, this is a lesser omentum, which has got two parts. The vertical part, that is called hepatogastric part, that is to the liver, that is hepatogastric, and this part is a hepatoduodenal part, gastroduodenal. It goes to the first part of the duodenum to the liver. So it has a vertical part, it has a horizontal part. First part of duodenum, first 2.5 centimeters give attachment to the lesser omentum of the peritoneal fold, that is to the attached to the lesser curvature. Now to the greater curvature, this is a gastrosplenic ligament which gives attachment to the undersurface of the diaphragm. Gastrosplenic ligament that goes to the spleen, hilum of the spleen. This is a gastrocolic ligament or greater omentum that goes to the transverse colon to become the transverse mesocolon till to the first 2.5 centimeter of the first part of the duodenum. So these are the four folds of the stomach which will be asked during practical examination. Now this is your posterior inferior surface. Stomach bed can come as a short note also. So you have to know what are the structure forming the stomach bed on which the stomach lies. Now let me tell you, stomach bed are those structures which are separated by the posterior surface of stomach by the lesser sac. Okay. So this is a dotted line showing this is the stomach. First let us say this is L1, L2, L3 vertebrae. This is your right crus, this is your left crus of the diaphragm, from which the diaphragm takes origin. These are the arcuate ligaments, medial arcuate, lateral arcuate. There is a left kidney. On the left kidney is a left suprarenal gland. Okay. Now this is the fold of the duodenum, second fold of duodenum, on which lie the head of the pancreas. This is the body and tail of the pancreas. On the body, this is the splenic artery which goes towards the hilum of the spleen. So these are the structures which are forming the stomach bed. This is ascending colon forming, this is transverse colon. This is the left colic plexure, this is right colic plexure, it comes to become the descending colon. So this is the greater omentum of stomach which is holding the transverse colon in position going back as the transverse mesocolon towards the posterior abdominal wall. Okay, that is the loop of the peritoneum holding the transverse mesocolon in position. So what is the mnemonic to remember the stomach bed? Doctor is the left crus of diaphragm, Shunil is the splenic artery, Shen is your left suprarenal gland, Keels is your left kidney, patient is your pancreas, it is the body of pancreas, anterior surface of the body of the pancreas, mercilessly is the transverse mesocolon, and cruelly is your left colic plexure. Okay, so this is your stomach bed. When comes in examination, you have to write the diagram and show the structures forming the stomach bed, and you have to know the mnemonics, but don't utter this, you have to write down these structures. Okay. Then the question which is asked during practical is the arterial supply. Which artery supply the stomach? Along the lesser curvature there are two arteries. Right gastric artery, this is a celiac trunk giving the hepatic artery, which gives the gastroduodenal branch, and the right gastric branch. So the right gastric branch is from the common hepatic artery. This is the left gastric direct branch from the celiac trunk. This anastomosis lying within the two folds of the lesser omentum along the lesser curvature. Now, this is the splenic artery, undergoes posterior surface of the stomach, reaches to the hilum of the spleen, gives the short gastric arteries which is supplied to the fundus, gives the left gastroepiploic artery. Now, there is a gastroduodenal artery coming from the hepatic artery, divides into superior pancreatoduodenal and the right gastroepiploic artery. So, along the greater curvature and the two folds of greater omentum, the anastomosis of the left gastroepiploic and the right gastroepiploic artery is there. that supply the anterior and posterior surface of the stomach. So this is your arterial supply, which is frequently asked during your examination of the practical. This is all about your stomach.